Welcome everyone to part 5 of Unit 8, Clinical Psychology. Today what we're going to be talking about is just our first kind of step into treatment. So now that we've kind of talked about all these different psychological disorders, we're going to look at how do we treat them. So we're going to start obviously here with just kind of a little bit of an introduction. We're also going to go over the first two kind of approaches to therapy here, which are the psychodynamic and humanistic therapies. Those are going to be pretty quick. We've already talked a lot about psychodynamic therapies before, so it'll be relatively short in this section. So the first thing is just thinking about the kind of two ways that we can look at treating psychological disorders. So modern Western therapies can be classified into two main categories. Now again, obviously we're taking this kind of modern Western approach because we live in the West, and that's the kind of theory we're going to use as psychologists. So there's two basic approaches to how we treat a psychological disorder. We have psychotherapy and biomedical therapy. Okay, psychotherapy, biomedical therapy. So let's look at each of these. The first one is psychotherapy. So psychotherapy is in treatment involving psychological techniques. Okay, that's the big defining aspect. It consists of interactions between a trained therapist and someone seeking to overcome a psychological difficulty or achieve personal growth. So anytime you go to a therapist of any sort, whether that's a psychologist or a psychiatrist or a group therapist or an addiction treatment center, right? Anybody that you're going to, when you're having some sort of interaction with those person or those people, that is going to be psychotherapy. Now we'll look at these different types of psychotherapy and what they specifically look like as we go here. This is obviously going to be the focus because as AP psychology class, we're going to focus on the psychotherapy aspect. We should mention though the biomedical therapy. So biomedical therapy is using prescribed medications or procedures to act directly on the physiology. So again, you can kind of think about how there's these two approaches where psychotherapy is, using psychological techniques to address these different issues that people are facing. Biomedical therapy is where we're going to use either medications, right, or procedures like surgery to directly change the physiology. So for example, if you're struggling with depression, right, the biomedical therapy would be, okay, we're going to put you on this medication. The medication is going to, let's say increase your serotonin levels or something like that, or increase your dopamine levels, and those will hopefully then, make you feel better. Where psychotherapy is going to be using these other approaches that we talk about. There is also what is called the eclectic approach. The eclectic approach is using psychotherapy and various other forms of therapy. Okay, so generally speaking, like the eclectic approach is probably where we're going to see a lot of work where, okay, I might use different types of therapies. I might also use biomedical and psychotherapy, right? We don't have to just use one or the other. And a lot of times that's going to be the case. Now, there are obviously people who are, you have to be an MD, medical doctor, to prescribe medications or at least have certain certifications. So not everyone that can, carry out psychotherapy can necessarily give, medications to people. So there will be, differences in, different types of professions and what they can do or are trained to do. And then again, eclectic approach, whenever we're talking about something that's eclectic, it's using a variety or using a wide number of different things. So, like I said, we're going to focus first on looking at the psychoanalysis and psychodynamic theories. Now, we already talked a lot about psychoanalysis and psychodynamics. Really, their whole perspective is connected with treating disorders, right? That's really where it comes from. When you think about Freud, Freud's everything he did was about treating psychological disorders. So they're going to use psychoanalysis. Psychoanalysis, where you're going to use things like free associations, resistances. We're going to talk about dreams. We're going to use transferences. And again, what we want to do is release previously repressed feelings, allowing them to gain insight. So again, the idea, you come in, you sit down, you lay down on the couch, your psychotherapist is going to maybe talk to you, have you do free association. They're going to analyze, they're going to take a bunch of notes, and over time, what they'll do is they'll say, okay, I've noticed that it seems like you have these repressed feelings towards this person, or you have anger. It seems like you have anger stored up about this part of your life or whatever. And the idea is that by releasing those repressed feelings, you then gain insight about yourself, and then you can grow. Psychoanalysis is really important because it's our first major psychological therapy. It's kind of the first thing that's became used by psychologists or psychiatrists to then treat people with disorders. And again, we already talked a lot about how free association works and those other aspects. So some key pieces when we're looking at or talking about psychoanalysis and psychodynamics. So we have resistances, so the blocking of consciousness of anxiety-laden material. We kind of talked about this when we talked about things like denial and repression, where we're trying to block off these anxiety-laden events, emotions, feelings, people, all those different kind of things. We have to talk about interpretation, so the analyst noting supposed dream meanings, resistances, or other significant behaviors and events in order to promote this insight. And we have transference. Patients transfer to the analyst of emotions linked with these relationships. So we've kind of talked about all these a little bit, except for maybe transference. The idea of transference is that your therapist should be a blank slate. So the idea is that when you come in, you can transfer, right, or project certain feelings onto that therapist. And again, that's going to help them, read into your mind a little bit. Remember, when we're talking about psychodynamic and psychoanalytic thinkers, they generally view there as this kind of unconscious pressures or pushes or pulls or drives that are affecting what's going on with you, whether it's your behaviors or your cognition. So what we're trying to do is get those out. Okay, and you can think about how all these are kind of connected. Oops. Whoa. Let me move myself here. Here we go. So psychodynamic therapy. Again, all of that is kind of involved in psychoanalysis. Obviously, psychodynamic is going to be very, very, very similar to psychoanalysis or psychoanalytic thought. It's going to be derived from it, just like we talked about when we talked about this general perspective. What we're going to do is we're going to view individuals as responding to unconscious forces and childhood experiences and seek to enhance self-insight. So again, you can see that's basically the same definition. Generally speaking, on the AP Psych test, you can pretty much look at psychoanalysis and psychodynamic as if they're almost exactly the same. You're kind of looking for the same ideas. There's slight differences, but when we're talking about this kind of general test, you can pretty much think of them as the same thing. But again, we're trying to look into your unconscious and pull those things out, again, to try and gain insight. Now what we're going to talk about is humanistic therapies. Now again, humanistic thought is all about growth. It's about potential. It's about subjective kind of thought when it comes to human beings. So our first example is going to be what is called insight therapy. So insight therapy is going to aim to improve the psychological functioning by increasing a person's awareness of underlying motives and defenses. Now you can kind of notice that this is very, very similar to what psychodynamic therapists are doing. And it's actually because insight therapy is kind of a combination of both. So we're looking at these underlying or unconscious motives and defenses that we have. The humanistic aspect, right, is kind of looking at boosting this focus on our thought, right? Boosting and focusing on, understanding ourselves and then aiming to improve, aiming to grow. And you can kind of see that in that last bullet point, right? Humanistic therapies seek to help people grow by boosting self-acceptance and awareness. Focus on conscious thought, okay? Psychoanalytic or dynamic are going to focus a little more on unconscious. Humanistic will focus more on the conscious part of things. We can also talk about what is called client-centered therapy. So client-centered therapy is therapy in which the therapist uses techniques such as active listening within an accepting, genuine, empathetic environment to facilitate clients' growth. Again, you should probably notice that when last time we talked about humanistic theories, this is what they really focused on, right? They focused on having this accepting environment that people can be in, and when we have this environment, they can grow. So it makes sense that that's how their therapy is going to look. We're going to create this environment that is loving and caring and empathetic and genuine, and that's going to then allow these people to grow. They're also going to use active listening. This is not like active listening isn't a kind of therapy. It's more of a tactic that we would use. So what it is empathetic listening, in which the listener echoes, restates, and clarifies. So a really simple example of this is, someone's telling you a story, maybe something happened, and they're really upset about it. So as they're telling the story, there's a few things you're going to do, right? You're going to, obviously you can think of like the physical things where you're looking at them, you can nod to them. But the bigger things is I'm going to echo what they're saying, right? So when they tell me about something, I maybe say the same thing back to them, or I restate something they just said, right? And they said, I'm just really upset because of this. And I say, oh, okay, so like this is the part that's really important to you. And I just kind of echo it back. Or I clarify, or there's something I don't quite understand, I ask a question about it. So what about this aspect? Or can you tell me more about this part? All of those are active listening. Now, again, active listening is just a component of this client-centered therapy that we're focusing on creating this environment that is accepting and empathetic. So that pretty much sums up our first two. So obviously, pretty simple. We're not going obviously super deep. I think one thing too I do want to mention, we're thinking about humanistic therapies. It's really is really driven by these ideas, right? We kind of have this idea of what client-centered therapy should look like, and then we kind of drive everything based on that. So once we know, okay, we want to create this, the question becomes, how do we do that? And then that's what we're going to do. Psychoanalytic and psychodynamic are really focused more on the things we talked about earlier in class, where we're using free association, we're using ink blot tests, we're using different things that people can project feelings onto. Okay, so that'll wrap up kind of the introduction and our first two examples of therapy. Take a few moments to do a quick summary for you, and I'll see you next time.